We focused in immune profiling data in one of the Spanish clinical trials that randomized elderly patients to lenalidomide-dexamethasone plus minus clarithromycin, because we felt that there was a gap in the literature about immune biomarkers to predict response and resistance to Len-Dex, which is a backbone of many myeloma regimens. But it is a backbone with other drugs, meaning that currently we can no longer address in clinical trials what are the biomarkers, because there are other drugs that may be a confounding factor in addition to Len-Dex. So we leverage on this study design to identify which are the immune cell types that can predict progression-free survival with the backbone of an IMiD such as lenalidomide and dexamethasone. And we found that this was possible. It appears to be complementary to other risk factors, and surprisingly, we saw that by using the same tools and the same data that was generated for the identification of immune biomarkers of survival in patients treated with Len-Dex, it was also possible to predict those patients that would develop severe infections during the trial. And we think that this data is important because infection is the primary cause of death in myeloma, and also because of the potential signal about the risk of severe infection with new immunotherapy drugs. And therefore, it might be feasible to use, for example, multidimensional and computational flow cytometry, not only to detect clonality, estimate tumor burden, measure MRD, but also simultaneously to characterize patients' immune profile, better predict outcomes, including the risk of infection.